So let's begin. My name is Jerry Rosberg. Just a brief word of welcome and introduction from me. Those of you who've been to our prior webinars will be pleased to hear that we have back again today the 3 stars of so many prior performances by this group. So that includes Donna Lynn, who is the University COVID Director, and Wafa El Sauder, who is University Professor and Chair of the Public Health Working Group that's been at the center of all of the university's decision-making about COVID since this whole pandemic began, and Melanie Burnitz, who is the Senior Vice President for Columbia Health. So again, if you've been to prior sessions, you're going to be surprised to see that we've changed the format slightly today. We're doing it a little bit differently in the hope of having as much time as possible to address your questions. If you have questions, please put them in the Q&A box. We will work through them during this program and answer them. If there are some that we can't get to, those questions don't disappear. We'll follow up on them in FAQs and other ways to make sure that eventually they get answered. So I think that's it for me. Oh, I did want to mention that one other change we've made is we've done these as an occasional series of webinars, and the demand for them, the interest in them seems so high that what we've decided to do is to do them now going forward on a regular basis. So every 2 weeks, you should expect another one of these webinars. That doesn't seem too frequent, given the rate at which the situation keeps changing and how much new news there is. But Donna, let me turn it over to you, please.
Great. Well, good afternoon, everyone. And I have a brief series of slides, and I'm the only one that's going to share some slides. I want to set the context for where we are in terms of COVID here in New York, as well as on the campus and in the hospital, and then turn quickly to vaccines. And as Jerry said, we're going to have probably a full almost 50 minutes of time for questions. I've gotten some in advance, and they're coming in quickly into the Q&A box. So we can go to the first slide. Thanks. So you undoubtedly have heard a lot of good news lately, both nationally about the COVID positive rate dropping, as well as in New York State, with the governor announcing a number of planned reopenings of things like movie theaters and sporting venues and the like. However, the New York State number, the 7-day average, is 3.4%. The New York City number is more than double that, which is concerning. And I'll share with you some information, though, about the campus efforts, which give us a little bit of a sense of safety, but I think still some concern around the New York City number being as high as it is. Just from a gross number perspective, we've had almost 1.6 million cases in New York State and over 700,000 in the city. But we are rapidly vaccinating people across the entire state of a population of a little over 18 million. 2.2 million individuals have gotten their first dose. And of course, there's a time lag between the first and the second dose. So ultimately, these numbers will catch up as we go forward. You can go to the next slide. This just shows you the map of New York City and where the positivity rates are. Of course, look at Manhattan. It has the lowest positivity rate, a little under 4%. But some of our neighborhoods, particularly up here at CUIMC, are darker, and there are darker areas around the city. And of course, that's still concerning for us, as I mentioned, the 7.2% rate in the city. You can go to the next slide. Our partner here at Columbia is New York Presbyterian Hospital, or NYP. They have 856 patients in their hospital system today, 162 of them here at CUIMC. We are pretty much at capacity across all the hospitals, and that's created some challenges just from a financial perspective, but it's a strain because we're still treating a large number of COVID positive patients. So despite some of the good news, the hospital data is not as good. But it's certainly not near what it was back in April. So we have had to reduce some of our inpatient admissions in the hospital, double people up, create some additional capacity. And we're doing it with pretty much the same staff we've always had, but we do have the military here now to help us out at Columbia. You can go to the next slide. This is just a graphic of, it's actually, you can't see the dates at the bottom, but that takes us from roughly the beginning of July. So you can see that actually at one point we had a very low number of 15 here at Columbia at the Medical Center campus. And as I said, we're now up to 162. So still concerning, and we want to keep all of our safety measures in place for both the campus, but the community. You can go to the next slide. And then, and we'll hear from Melanie as we get into some questions. There's been a campus-wide asymptomatic testing program since June when we had the research ramp up, and we're actually over 160,000 tests right now. And our positivity rate, keep in mind, if New York City was at 7.2, our positivity rate last week was 0.42. So we are doing significantly better on this campus than the city is as a whole. You can go to the next slide. And then this just gives you a snapshot. If you're not familiar with the COVID-19 website, you ought to get familiar. This gives you the data that I just referred to, but you can also get cumulative data. You can get it sorted by campus as well. Next slide. And this is the snapshot of the campus. So you can also see not only where the cases are, tests are being conducted, what's positive, what the positive rates are, sorted by faculty, staff, and students. You can go to the next slide. So I want to turn in the last couple of slides to the vaccine, and that'll be a big conversation that we have today. As you know, we started vaccinating people in New York once the vaccine became available in mid-December, just right around December 15th. I will continue to restate the supply is less than the demand. We have a lot of demand. The governor's office has categorized people who are eligible for the vaccine into categories. The first one that he announced was patient-facing staff in hospitals. It ultimately expanded to patient-facing staff in outpatient settings as well. Nursing home residents and employees were part of that first group that we call 1A. And there's been a series of announcements subsequent to that 1A group of 1B individuals, first starting with people age 75, dropping to 65, and then certain public-facing workers or employees, from public safety to transit to educators, including in-person college instructors and others. Just last week, the governor expanded 1B. He had announced this all along when he made the change to 1B, but people with underlying or comorbid or conditions became eligible for the vaccines on the 15th, and I'll talk a little bit about that process. And as I said, we've got 10 million people in New York, and we're not getting anywhere near the vaccines that we need to meet the demand. That's true across the entire country. And when people ask, probably the most common question is, when can I get the vaccine? We're generally saying well into June. You can go to the next slide. And you've met Jerry at the beginning of this. We did create a Columbia Vaccine Task Force. The vaccine right now is not mandated, it's strongly recommended. We've been doing not only these town halls, but other writings and information. And Columbia doctors and Columbia Health are actually have been approved to be vaccine providers. We're hoping to hear soon whether or not we can do that, and based on getting the supply of the vaccine. You can go to the next slide, and I think this is the last one. There's been a lot of activity. New York Presbyterian, who is our partner, opened up a vaccine hub here in the Washington Heights neighborhood. They've done well over 80,000 first doses, which is huge. Part of them, a little over half of them, for affiliates of either New York Presbyterian, Columbia, or Weill Cornell. But there's a broader campaign that started in January to vaccinate the community, including the Washington Heights community. So we have a number of options that you have as Columbia affiliates to get your vaccine at the Armory, but there's certain conditions that the governor has specified in order for you to get the vaccine at the Armory. First, you have to be a New York City resident. You have to either be age 65 or you have to have, as I said, these underlying medical conditions. And today we started vaccinating individuals at the Armory, and we're actually able to help people get appointments. I know getting an appointment has been challenging. And the last slide I just want to touch on is, you can go to the next slide, is just where you get information. As I said, that middle website, covid19.columbia.edu, is the source for everything, whether your questions are about travel or testing or other. VaccineTogetherNY.org is how you make an appointment to get a vaccine at the Armory, and www.one.nyc.gov is where you find information out about other public sites. As you've heard, the governor, the mayor have created public sites in schools, in the Javits Center, and other large sites. So that's a little bit of a summary. We can take the slides down, and I'm going to jump to some of the questions because we've gotten a few in advance. And so I'm going to turn to Melanie for the first question, which is about the CDC guidelines. With more and more people getting vaccinated, I understand that the CDC has changed their quarantine rules so that if you have the vaccine and you've had it for at least 2 weeks, you don't have to quarantine. Melanie, is that true, or is there some issue in New York State?
So it is true. The CDC did change their guidance. And good afternoon, everyone. Thanks for having me here today. So the CDC updated their guidance with all these pieces. When the CDC updates any of these public health guidance, we have to await adoption by New York State. Now, the day after the CDC made this announcement, Governor Cuomo, in a press conference, did announce that New York State would be adopting this. However, the official written guidance has not yet come out from the state. So we are in a holding pattern right now. We have to wait for Department of Health guidance that gets adopted first by New York State, then by New York City before we can implement this. So what does it mean? It means if you've had 2 doses of vaccine today and you are exposed to someone in New York State, you are still required to quarantine. Just as soon as the state updates the guidance, we will be adopting that as part of our contact tracing process. So we are collecting that information from anyone through the contact tracing process, and we are just waiting for it to be put in writing so we can follow through.
Great, thanks, Melanie. I'm going to turn to you again on a question about vaccines. And as everybody knows, our attestation, which produces a green pass for us, has been active for more than 6 months now. And the question, Melanie, is will vaccinations be part of the CU app going forward? So there's an indication that you've actually had that vaccine.
Right. Currently, the answer to that is no, because it's not changing any of the other guidance. If you have symptoms, even if you are vaccinated, you should be staying home. The only exception to that is around in the first 2 days after your vaccine, if you have certain symptoms, which exclude a fever, and that goes away. But that is actually already incorporated into the app. So if you check that symptom box, you'll see there is a question around vaccine. But outside of that, right now, we're not anticipating a change based on vaccination because we still have to wait for a larger proportion of the population to be vaccinated before we start letting up on some of those other requirements.
Great, and I'm going to give you one more and then I'll let you take a break. Once fully vaccinated, do you still need to go through random testing?
Yes. The answer is yes. And the reason is, again, linked to what I just said. Until we have all the information we need, until more people are vaccinated, until we see impact on variants and all these other pieces that I know we're going to discuss today, it's really important for us to be looking still for asymptomatic carriage of the virus, potential for asymptomatic spread. It just really continues to give us information so that if you're selected for random testing, even if you've had your 2 doses of vaccine, please do follow up. That information is really important for us as we look across the broad public health, the broad prevalence in our communities. We need everyone to continue to participate so that we can continue to act on those results.
Great, thank you. I'm going to turn to Jerry for a general question. I haven't been on campus for the last year because I've been able to work remotely. What do you think keeps this campus safe?
Well, I think when you do get back, you're going to be quite startled by the changes that have taken place. And I think the sense of safety is strong. I think it's pervasive. I think you're going to be impressed by what you see when you get back here. A lot of our buildings are quiet, but I think that's part of a deliberate attempt that we've made to reduce the density in the buildings for the sake of keeping people safe. You're going to see a lot of signage that encourages compliance with all of these various protective measures that are required. You're going to see new fixtures throughout all of our bathrooms that are no-touch fixtures that are an important part of safety. And a key piece that you won't see, but that we believe is going to help keep people safe, is major changes in the air handling system, ventilation, HVAC, filtration, all of that our facilities people have worked extremely diligently and very, very smartly to improve the safety on the campus.
Great, thank you, Jerry. Wafa, we've got a lot of questions about the vaccine. I'm gonna toss a few of them to you. One is, I've heard about the Johnson & Johnson vaccine coming up for approval, and it's a one-dose vaccine. Do you think Columbia and NYP will be using that vaccine, and what's your general sense of its efficacy?
Yes, and thank you again for the opportunity to speak to all of you today. Yes, there is exciting news is that the data from a large study with about 44,000 participants was recently completed of Johnson & Johnson Janssen vaccine. And what distinguishes this vaccine are two things. One is that it needs only one dose rather than two doses for current vaccines that we're using. And the other is that only needs refrigeration. So that's makes it easier to handle this vaccine. The studies that have been done, the data that we've seen, show that the vaccine varies in terms of its effectiveness based on where the participants were. So in the US, it was 72% efficacy that was demonstrated. It was a bit lower, 66% in Latin America and 57% in South Africa. And we'll talk about the variants in a bit. Also, the good news is that there were no serious adverse side effects also noted with this vaccine, only mild to moderate side effects, as has been noticed with the Pfizer-BioNTech and the Moderna vaccines. The data from these studies will be discussed by an independent FDA advisory group that will meet all day on February 26th to go through the data that the company has submitted, but also to go through the data that the FDA researchers themselves have analyzed. And we'll see how the discussions go, but it's anticipated that by the end of the day, in all likelihood, this advisory committee will recommend to the FDA to provide emergency use authorization for this vaccine. So I think this will be great news because as Donna touched on, we've had this disconnect between the supply versus the demand for the vaccine. So having another vaccine approved and available hopefully will make it a lot easier for people to be able to get vaccinated, and hopefully will get us also to reach vaccinating more and more groups in a more rapid manner.
Great, thank you, Wafa. I want to do one housekeeping matter, which is we are recording this session. So if for any reason you do have to drop off, you will find this on the COVID-19 website. It generally takes us a couple of days just to get it posted. Wafa, I'm going to go back to you. This is someone who has had COVID-19, and this individual wants to know how long they should wait before getting the COVID-19 vaccine, and should the dosage change, or should they get both doses?
Yeah, the recommendation is that people who've had COVID should get vaccinated as per the regular schedule of vaccination for whatever vaccine that they are getting. And the reason is that it's been noted that the immune response, the antibody response, the protective response is much higher after the vaccination than it is after having an episode of COVID-19. Most experts would say to wait till full recovery, no symptoms from COVID-19 before seeking vaccination. And again, the recommendation thus far is to take for example, for the current vaccines, is to aim to get the two vaccine doses.
Great, and I'm going to give you one more before I give you a breather. When do we expect to have evidence on whether or not vaccination prevents the vaccinated from infecting others?
Yeah, that's been a hot topic of discussion. There's evolving evidence by the minute. There's some very encouraging data from Israel, for example, where the country has had a very robust vaccination campaign. And what they've noticed is that appears to be a decrease in terms of infection as in that context. And there also are as well some data from some of these studies that have been completed more recently with newer vaccines, like the Novavax vaccine, for example, that do suggest that these vaccines may be protective against infection without symptoms. But again, we are still awaiting definitive data, but I think the evidence is going in the right direction.
Great, thank you. I'm going to answer one that came in about K through 12 or even P through 12 teachers. Are they eligible, since now, as I mentioned, the governor included them in the 1B category? Are they eligible for vaccination at the Armory? They are not eligible for vaccination at the Armory. That's why we want to provide the New York City link so that you, in person, both K through 12 as well as college instructors can get the vaccine at those locations. The Armory restrictions are: you have to live in New York City, you have to be age 65 or over, you have to be a, remember that 1A category that is patient facing, you have to live in New York State. And for the persons with underlying health conditions, they can be age 18 on up, but they also have to live in New York City. The reason is that the allocation is done by county, first from the federal government to the states, the state to the counties, and we would have a mismatch, and perhaps New York City would look as if it wasn't performing, for example, if the data said they got 1 million doses, but only 500,000 New York City residents got vaccinated. People were coming from other counties. So that which originally wasn't clear is now clear. So you must be a New York City resident. There are other options, and we hope to have more information for the in-person instructors in the next week or so. Wafa or Melanie, I'll let either one of you, could you please advise on the use of masks outdoors?
I can start with that one. We advise masks at all times, just knowing that more and more people are out and about, and we see that particularly on campus. We have the rule on campus, masks indoors and outdoors. It's just good practice. When you walk with people, oftentimes you have to really remind yourself about the 6 feet. So our mask recommendation is masking at all times, except when you're in your private office or your bedroom with your door closed.
Great, thank you. Wafa, there's been some literature to follow up on that a little bit. There's been a lot of conversation about wearing more than one mask. Could you comment on that practice? And is Columbia going to be adopting something like that?
Yes, thank you. And actually, very recently, the CDC has shared some interesting data on the question of on the issue of double masking. So they did an experiment, and the experiment in a laboratory, and it showed that double masking was superior to single masking. And the double masking has to be very, very specific. It's one of these surgical or medical masks, as well as a cloth masks. And of course, both of these masks have to completely cover the nose and the mouth. The other option that was also identified is to tie the ties at the corners of these masks, because this actually, if you tie them here and then you put the mask on and you tuck this extra mask material inwards, that can also prevent the gaps on the side of the face. What's critical with masking is are two things. I call them filtration and fit. So very important to make sure at least 2 layers in the surgical mask and also 2 layers in the cloth masks, or to do the knotted side of the mask as I demonstrated. But again, most importantly is to make sure that the masks are over the bridge of the nose, molded to the bridge of the nose and extend to under the chin.
Great, thank you, Wafa. There's a question about women of childbearing age. If Wafa wants to add comments to that, I would tell you that if you go to the CUIMC website, there was an entire session that we did back in January for not just women of childbearing age, but also men. So it was focused on pregnancy and fertility. But Wafa may want to comment about that general issue.
Yeah, in terms of women of childbearing age or pregnant women for that matter, obviously always recommend that they consult with their provider, but CDC and WHO both indicate there is no contraindication to getting vaccinated with the current vaccines because the risk, there have been some studies that have shown that pregnant women in particular appear to be at higher risk of complications if they get this virus, if they get COVID-19. So the risk from the vaccines is much less than the potential risk of a COVID-19 episode to themselves and to their baby.
And in fact, pregnancy is one of the chronic conditions, list of the chronic conditions for vaccine eligibility.
Yes, current ones. Yeah.
Currently, right.
Jerry, there's a couple questions about an email that you and I sent out yesterday. So I'm going to toss these to you. One is, I'm under 65 with a pre-existing condition. Can I be vaccinated at Columbia? I assume that means the Armory. This is a person who does not live in New York City.
So in principle, yes, except for the residence part, as I understand it. And Donna, I need you to check me on this, but that it's New York City and not just New York State.
That's right.
If you can qualify as a New York City resident, then you would be eligible by virtue of the pre-existing condition, the underlying condition.
That's right. Great. And then another question about vaccines at the Armory. Will family members be able to get vaccines at the Armory?
So I think, well, let me take a crack at this first. I think the problem is that you have to be eligible in your own right, not by virtue of being a member of someone's family. So if you meet the age criteria, the employment criteria, the underlying condition criteria, then you would be eligible. But by virtue of a family relationship, that won't do it.
Yeah, maybe the easiest way to remember this is unless you're a patient-facing employee, you have to live in New York City to get vaccinated at the Armory and at other places. In other words, you can't be from Dutchess County and come down and get vaccinated in one of the New York City areas. Again, as I said, the supply goes from the state to the counties, and the counties are all monitored for their what they receive versus what they administer.
Donna, can I just jump in also to just say, I think it's important to stress, we're all focused on the Armory because it's close at hand and it's a wonderful facility and it's staffed by fantastic volunteers, many of whom are our own Columbia people. But there are many other places to get vaccinated. So the in-person instructors, for example, who have become eligible are not being vaccinated at the Armory, but we've heard many, many stories of people being successful in getting appointments and actually getting vaccinated elsewhere in the city.
Great. And Jerry, we do have a question about that in-person instructor. And this is someone who says, I work in person for the university, but I'm not sure that my role counts as an instructor. How can I get more clarity about my eligibility?
Well, the thing to do is to talk to your supervisor, talk to the school or the place where you work, because this is being managed at the local level. They know who are their in-person instructors and who are not. But sadly, we've had to take a pretty strict reading of what is meant by the term in-person instructor. it may help to just retrace how we got to this in-person instructor. It started with teachers in the elementary and secondary schools. I think that was the real objective, to get them eligible for a vaccine. It was then extended to people who are in-person college instructors, that was thought to be close enough to the core group that it made sense for the state to include them. But other people who interact with large numbers of people don't qualify by virtue of that. So you really have to be an instructor at this moment in time.
Right. And well, we have several questions about this. One is, why can't I get a vaccine? If I fit in that category, why can't I get a vaccine at the Armory? The answer is Columbia doesn't run the Armory. We do volunteer there. We have some questions about that. But NYP made the decisions around what the eligible categories are based on what the governor said. So in-person college instructors as well as in-person teachers do have to go to those city sites in order to get their vaccine. Okay, Wafa, I've got a couple of questions, very clinical based. We have someone who wants to know if there is a comparative outlook between the COVID-19 therapeutics, for example, Regeneron and Plaquenil, and the vaccines.
Well, I think there are data that have been released recently that show that giving some of these monoclonal antibodies, like the Regeneron one that you mentioned, that is mentioned, that can be very useful in preventing severe COVID-19 in individuals who have mild symptoms, for example. And there's been another study with another monoclonal that shows that it actually was protective if given to people who've had close contact with COVID-19. The latter study was done in a nursing home. So certainly there are evolving data on these monoclonals that show benefit both for prevention amongst close contacts as well as for treatment of mild to moderate disease, not severe disease. I think we should be cautious, though, is there's concern that as we move forward and some of these variants are evolving variants, and we'll talk about them shortly, is that we want to make sure that the monoclonal antibodies that have been produced are still active against some of these new variants. Of course, the vaccine is much is advantageous because it's one dose or two doses, and of course it's given to people without any symptoms. So it's used purely for prevention amongst everybody. You don't have to be a close contact. You don't have to have mild COVID disease. So they're they're each used in very different contexts.
Great, thank you. Will Columbia employees be able to receive a vaccine at NYP in May or June if they are not New York City residents? I can't predict May or June, but I can tell you right now that wouldn't be the case. Again, because the distribution is by county, the administration and the reconciliation is also by county. Wafa, is there any data on COVID transmission through vaccinated people?
We haven't, there haven't been any case reports, but it's possible because, of course, as you know, there's no vaccine that's 100% effective. We know that they're very good. So it's possible that maybe somebody who's vaccinated who's not fully protected. So that is always a possibility. And as I mentioned, again, we're concerned about the potential of people who've been vaccinated having an infection and being asymptomatic. And I think for those reasons, we recommend that vaccinated individuals continue to wear masks and distance and observe all the other preventive measures.
And maybe Melanie can take the next one, but the chorus from WAPA, because it's a similar question. Will Columbia be able to link a vaccinated person to their test result?
So absolutely, if a person tests positive, we do full and complete contact tracing, and part of that contact tracing process, it does now include asking about vaccination status. So we're certainly we are monitoring that moving forward. We certainly saw people test positive a day after dose 1, that's because their infection had occurred before dose 1. So it is something we track and we do link because of the contact tracing process, and certainly will add to our understanding and the broader data around this as we move forward, particularly as people get many months out from their vaccination dose and we continue to contact trace and track.
Melanie, another related question about testing and vaccines. Did your answer about the importance of continued testing for those vaccinated also apply to the voluntary weekly testing program? And this person is conscientious and thinking, maybe I shouldn't get tested anymore.
So I really appreciate that question, and thank you for asking it. It's one we're debating an awful lot, and right now our recommendation is continue testing because we're still adding to the information and the understanding around this. We're very fortunate to have a robust testing program that can accommodate weekly testing for those who are accessing campus, and those who want to still avail themselves of the voluntary testing are welcome to do so, even if they are fully vaccinated, because that data is very, very helpful to us.
Right. And then a related question is, are you interested in, after people are vaccinated, volunteering for testing, or should they only get tested when randomly selected?
Again, I'd say if you want to volunteer and do the weekly testing, we know many people who are vaccinated are living in households where other people are not vaccinated and maybe don't have access to testing. So we're certainly not discouraging anyone from participating in voluntary testing, regardless of vaccination status. At this time, once we reach higher levels of vaccination and start to see lower levels of positivity rate, we may change that recommendation, but right now it's unchanged.
Jerry, I have a question for you about what the university's policy might be in the future around mandating that personnel receive the vaccine.
So I think it's premature to speculate about this. We had a very deliberate, very serious discussion about this and concluded that it was not appropriate now, given where we were. I remember that one of the key considerations was that the vaccines themselves were in an emergency use authorization category that caused us to be cautious about that. Whether that could change at some point in the future, I don't know. I'm certain there will be discussion of this, and any decision that is made would be made with a lot of consultation with our public health colleagues, the people who are here on this call now. But there's no plan to do that now. That's a discussion for the future.
Wafa, we have a couple questions about people who have had COVID and wondering, is there a period of time in which they should wait before they get the vaccine?
I think, as I mentioned before, I think it's recommended to wait until a person recovers from the acute episode of COVID. That's all that is in the recommendation. There's no reason for a predefined period of time. So I think it depends on the person and their symptoms. If they have recovered in 3 or 4 weeks, they might want to, then just, and they're eligible for vaccines, then they can seek a vaccination at that point. There was at some point a recommendation to wait a bit longer period of time, but that was largely because of, again, the limited supply of vaccine and the need to prioritize getting people vaccinated who have absolutely no experience with COVID at all.
Great. Here's a question I'll answer, which is wondering if people who have underlying medical conditions or comorbidities need a letter. You generally do not need a letter. I think most vaccine locations, including the Armory, are simply telling you you need to attest that you have that condition, an underlying medical condition. It is a good idea to look at the state website to find out what an underlying medical condition is. It's not broad. I had somebody who said, I get headaches. Is that an underlying medical condition? The answer is no. Somebody who has diabetes, dementia, Alzheimer's, those are underlying medical conditions. So that information is available on the state website. We don't expect there will be a proof, somebody asking you to produce a letter. But in some cases, for example, we did send out letters to patients of Columbia doctors telling them that they had an underlying medical condition and they were in fact eligible for the vaccine. Wafa, we have a few questions about a topic that's getting a lot of attention, which is the variants. So could you talk about the variants and whether the vaccine is effective with the variants that we're seeing?
Yes, I can talk a bit and just maybe step back and describe what is a variant of this virus. So the SARS-CoV-2 virus, like many viruses similar to it, as it multiplies, as it infects an individual, and as it multiplies, it makes mistakes during the multiplication. And this causes what are called mutations in the virus. Some of these mutations are not good for the virus. They may actually cause the virus to die, but other mutations might be advantageous to the virus itself. And then, so that's what we mean when a virus mutates, there's a new variant that then evolves. And the experience thus far is that some of the variants you've heard about, like the variant that was identified in the United Kingdom, for example, that one is thought that the mutation that happened resulted in a virus that was more easily transmittable between people. The good news is that we don't have evidence that these new variants have been more deadly, causing more illness or more death. There is another variant that's received a lot of attention. That's the one that was identified in South Africa and predominates now in Southern Africa. And that variant has been shown that actually for several of the new vaccines that have been studied during the period of time when this variant appeared, that these vaccines were not as effective as in other parts of the world that didn't have that did not have that variant. And that's why we see some studies now that have been done more recently where the efficacy is higher in the US, for example, than it is in South Africa. And that's because of the new variant. So the concern is that as this virus evolves and these new variants arise, is that some of these may outsmart our vaccines. A couple of things that just to, the question is what to do about this. I think one very important thing is to stop this virus from being transmitted, because that's how it multiplies and these variants arise. And that's through the protective public health measures that we've been talking about. And the second aspect of this issue is that the vaccine companies themselves are now developing new vaccines using the same technology they used in the old vaccines, but now are using viruses that are of these recent variant types. So this way, they're hoping to develop vaccines that will actually be effective against these new variants. And the good news is that the FDA has said that if you are developing you have already a vaccine, let's say a company, Pfizer, has already a vaccine that's been approved, and then wants to develop a new vaccine using the similar technology it used before, but against the new variant, they don't need to do the very large studies. They can demonstrate through smaller studies that this is safe and so on, and they will get rapid approval. So it's possible that in a year or so, we will have to, for people who have been vaccinated, then maybe they need to get booster shots, depending on how widespread these variants are at that point in time.
Great, thank you. Is someone studying that, Wafa, now, the need for a booster shot and the incidence of maybe getting COVID after you've been vaccinated?
Well, we don't have, as of yet, these booster shots. They're under development now because these companies are taking these variants and developing the vaccines as we speak. So we don't have any experience yet in terms of their use in humans.
Okay, thank you. Melanie, a question about the summer session coming up. Have there been any decisions regarding gateway testing for the summer session?
It's an active conversation right now. Anyone who has not been who has not had a gateway test since January 4th will have an automatic red pass, and the anticipation is that will hold true. So if you're coming back for summer session and you haven't been on campus, you will likely need to get a gateway test before the start of summer session. We will be providing messaging on that as we get nearer to the time. Obviously, we're tracking the data. We're going to track positivity rates, vaccination status, and then, as always, that will inform the public health decision around testing. But if things stay pretty much as they are now, those coming for summer session will be required to have a gateway test, yes.
Great, thank you. Jerry, we have a question about staff, particularly administrative staff and space. where 6-foot distancing, should it remain a rule, wouldn't make it possible for them to come back. So the question is, will we be able to continue to work remotely, or are you planning on redesigning offices?
So I think there are 2 points here. One is the changing our physical space to make people as safe as possible. If we have to do that, we'll do that. We've actually made some very significant changes already in classrooms and other settings in order to keep people safe. What I think is the harder part of this question is, or the more, for me, more interesting part is, what do we know about the return to work? When is that going to happen? What should people expect? We know that's a question of concern to many, many people. And I think this is a situation constantly being monitored, constantly being discussed. But there are a couple of points that everybody who is working remotely now should keep in mind. Number one, if you're working remotely now, you should stay working remotely for the foreseeable future. Certainly that means through the current term that we're in. Nothing is going to change imminently. Secondly, when a change occurs, we have assured everyone that we will give you 3 weeks notice before there is a change, so that it's not going to be sprung on you. Third, and for me, the most important point, I think it is extremely unlikely that we're going to wind up having everybody return at once. What we're trying to work through now is the process of a gradual or phased return as conditions warrant. So the message from me on this point is, please don't be anxious about this, that suddenly you're going to get an announcement that you have to be back in 3 weeks and you're not prepared for that. This is going to roll out slowly and in a very careful way as conditions permit.
Jerry, a related question speaks to the fall semester, and the concern this individual has is, what if they can't get the vaccine in time for the fall semester? Would that mean that in-person teaching wouldn't happen, or is Columbia going to step in and somehow make sure that people can get the vaccine by then?
Well, so I would love to say, yes, Columbia will step in and make sure it happens. I'm just not convinced that that's going to be within our power to do it. But I think the fall is far enough away that I think we're going to be in a very, very different situation in terms of vaccine availability by then. Protecting people who are teaching in our classrooms is a huge priority for the university. So we will do everything we reasonably can to make that work.
Great, thank you. There's a question that it's a very good question that I don't have the answer for, but I'll take a stab at it. It says, since 1B includes 18 people 18 and plus with comorbidities, why are we continuing to expand the eligibility criteria when the supply is not enough to vaccinate all of 1A? That's an excellent question. And I think many of us have asked that question, but there are some very strong voices. And by the way, what we do in New York is not what's being done in other states. Some other states only do 70 and above. Some of them are doing mass teacher vaccinations. So it's the judgment of the Department of Health about how the criteria is expanded. And I think I hope that we will see the supply increase, but there isn't a rhyme or reason that I could put to this expanding category, as I said, of 10 million people. There are a number of questions about volunteers at the Armory, and rather than answer them individually, what you can do is email me after this, and I'm happy to answer those questions for you. A lot of concerns about volunteering and so forth. Wafa, I think we've asked this question before about the prevalence of people getting COVID after they get the vaccine. This one's a little different, which is, are there statistics about hospitalization of asymptomatic people who have been positive? Who have positive tests. In other words, what percentage of people land in I read this as, what percentage of people land in the hospital who are not symptomatic, but do test positive?
Yeah, I don't know if we know the answer to this question. So I think the person is asking, is there anybody who's just swabbing everybody in the hospital, irrespective of symptoms, whether they have symptoms or not of COVID. And I have not seen data on hospitalized individuals specifically on this question.
Great. We have some questions about allergies, Wafa, specifically one about penicillin, but maybe the flip side of that is, apart from allergies to the vaccine itself, is there any reason someone should not be vaccinated? So I think you need to address penicillin, but then are there actual allergies to the vaccine that you've heard of?
And I think the recommendation is clear that thus far is that people who've had a severe allergic reaction, what we call anaphylaxis, severe allergic reaction to any of the components that are in this vaccine, and you can find those components online, then that individual should not receive these vaccines. That's very clear. I think that's important to keep in mind. In people who have had other severe allergic reactions, like, for example, to penicillin, that's a common anaphylaxis to something like penicillin, it is not contraindicated for such individuals to be vaccinated, although we do recommend that they get vaccinated in a clinical setting. So in case they do develop a reaction, then they can be managed appropriately. So that's what's recommended at this point in time. If somebody, the other question that has arisen, if somebody has received one of the vaccine, the first dose of the vaccine, and had a severe anaphylactic, severe allergic reaction, certainly they should not receive the second dose of the same vaccine. So that's also important to keep in mind.
There's a couple questions I'll try to tackle. One is there a schedule when the Pfizer vaccine is administered versus when Moderna is? The answer is no. We get what we get. It depends on the supply, again, that trickles down from the federal government to the state and then to the city. Pfizer is much more available, and so the likelihood, it's particularly if you're getting your shot at the Armory, is that you're going to be getting Pfizer. Wafa, another question for you, which is, if the person gets the first vaccine shot, then gets COVID, should they get the second vaccine shot on the same schedule, either 3 weeks later or 4 weeks later?
Another interesting question. I think I would say they should wait till they recover fully from the COVID episode before they, again, like I said before they get the second dose. Although it is, of course, recommended to stick to that schedule as much as possible. Let's say if somebody does have symptoms, it probably is not, if they still continue to have symptoms, to go for their second dose. They can delay it somewhat until they fully recovered.
Great, thank you. Melanie, I'm going to turn to you for a question about the transmission of the virus through ventilation systems. So the question with respect to the Columbia campuses, shouldn't masks be mandated in dorm rooms and in big apartment buildings?
Yeah, this has been a really big question, and I think the data, and Wafa can probably provide real data on this rather than my just the summary of it, is that a lot of theoretical work has been done looking at ventilations, but we're not seeing transmission in office buildings, in apartment buildings through ventilation systems. The transmission really is person to person. We're even really, starting to think about fomite transmission and these other methods. So it's really the person to person, which is why we have this feeling of safety that when you're alone in your dorm room or in your private office, you can take your mask off. But the reason to have your mask on in other spaces is really to reduce that person to person transmission.
Great, thank you. We have a request, Robert, and I don't know if you can, maybe we can do a split screen now. The last slide in my presentation had the websites for appointments, and several people have asked for that. So it's vaccinetogethernewyork.org, but there were the city website as well. So maybe you can do a split screen for that.
I can add in the chat box also while we're
great, thank you.
Q&A. Yeah.
Wafa, we have a question about herd immunity.
Yes.
And is it possible that the virus can still be transmitted even with the vaccine? And how can we ever reach herd immunity?
I think the idea is that is that if you have a vaccine that works well, highly efficacious, highly effective vaccine, and you can vaccinate sufficient numbers of individuals so that you have sufficient proportion of the population that is protected. It doesn't have to be 100% of the population that is protected. Is that once you reach, and some people think the threshold is about 70 to 85% of the population being vaccinated with the current highly effective vaccines, that when you reach that, you would achieve population or herd immunity. And what it's all about is that if you have one person who's infected, for example, however, in their community, in their surroundings, the other individuals, 3 of the 4 other individuals are vaccinated, you are potentially likely to transmit the infection to one of those 4 people that you're in contact with. But for the other 3 people, their vaccination almost forms a barrier to reaching an infection to others in the community through them. So that's the whole concept of herd immunity, is that as you increase the numbers and the proportion of people who are protected in a community, you are really blocking the further transmission of the virus.
Here are 5 or 6 questions that I can see that relate to the proof that you need to bring when you go to a vaccination site. You need proof of residence. Again, in New York City, you must live in New York City. That includes all 5 boroughs. So you could go to Staten Island and still live in the Bronx, bring proof of residence. There are a few sites that are, the one at Yankee Stadium, for example, that opened up was just for Bronx residents. So please be aware of that. And you also don't need to bring proof of your medical condition if you're in that 1B category. You have to attest, there's a form that you fill out that says that you have an underlying medical condition. And then the last question, Wafa, which I'm going to turn to you, is can people get reinfected and have COVID more than once?
Yes, there have been a handful of case reports of individuals who had definitely confirmed COVID, and then several weeks later developed another episode of COVID. But like I said, what we know based on what's been published are literally a handful of cases. So that's what's available now.
Great. Well, we had many more questions. We thought this was a good format. We did get through a lot of questions, but we have many more. As I said, you're free to email me about the volunteer program at the Armory where you have questions about that. And we'll make sure that we respond to the other questions as part of the FAQs. So thank you. We will be doing another one of these. Things are evolving very rapidly in terms of the vaccine, and we know that there is a tremendous interest for our own Columbia affiliates being able to get the vaccine in other locations, and we are working on making sure that we can ensure all of the eligible people in our community can get vaccinated. So thank you very much, and thank you to all of the speakers, and we look forward to seeing you again. And remember, this is recorded and will be on the website in a couple of days. So thank you, everybody, and good evening.
Thank you.